call the meeting of the Lake County Community Advisory Council meeting to order. As we do every meeting, I want to welcome everyone and appreciate your time. We'll try to be very conscious of your time. What I'd like to do is have each person introduce themselves and why they are coming to our meetings. We appreciate that. So Mary, we'll start with you, please.
I'm Mary Ann Wynn. I'm the Integration Coordinator with Advantage Dental, and I'm here because dental is important and I want it to be spoken at the table and integrated with everything else. And I'm Tiffany Boyd. I'm going to be the new community dental hygienist here in Lake County. And I'm just excited to be here and be able to meet all of you guys in person. I live in Bend, so.
Welcome, Tiffany. I'm Arvinder Singh. I'm the Community Health Improvement Partnership Coordinator for Lake County, Lake Head District.
I'm Diane Clay, and I'm with the Lake County Food Chair and Lake County, or the Lakeview District Hospital Auxiliary, and several others. And I'm just an interested community person.
Thank you.
I'm Francie Winters. I'm the Prevention Coordinator for Lake Health District Wellness.
Judy Clark. I am the Director of Public Health.
Janine Sims. I'm from Lake Health Clinic, and I'm the Care Coordinator Nurse, and I help co-facilitate the Living Well with Chronic Pain Self-Management class and the Diabetes Support Group.
Jimmy Hall, Lake County Examiner, newspaper.
I'm Susan Campbell, I'm the Lake Health Clinic Manager, and I've also recently been appointed to a leadership position with the New Pine Creek Fire Department, so I'm kind of just bringing lots of information back to them.
Barb. I'm Charlie Twite, for those that don't know me. I'm the hospital CEO here.
Paul McGinnis, Integrations Director with Greater Oregon Behavioral Health and the Eastern Oregon Coordinated Care Organization.
I am Alana Shamulak. I'm the Eastern Oregon Healthy Living Alliance. I'm the Program Coordinator. I work on the dental program and mental health first aid.
Rod Harwood, Older Adult Behavioral Health Specialist with Greater Oregon Behavioral Health Incorporated, here just supporting and encouraging and addressing the needs of our elders and those with disabilities in our communities.
Marvelous. And who do we have in the, oh, Shelley, you already told us. You're from Lapine, right? Lapine Clinic?
Hi, could you guys introduce yourselves over the phone?
I'm Shelley McKittrick. I'm the Outreach Manager for the Lapine Community Health Center and also in Christmas Valley.
Thank you, Shelley. Anybody else?
Is there anybody else on the phone? Yeah, I guess that's it.
Okay, great. Well, thank you. Has everyone had a chance to look at the minutes? If you haven't, could you take a few seconds to do that now? And when we're so ready, we'll entertain a motion to approve them. Diana, do you want to make a motion to approve these?
Sure.
Excellent. Just suggesting things here as we move along.
I second the motion.
Excellent, thank you. It's been moved and seconded. All in favor, please signify by saying aye.
Aye.
Any opposed, same sign. Excellent, thank you. Paul, could you talk to us about Lake County cost and utilization report?
Yes, I will. And first of all, I want to let you know that as soon as I got the report, I wrote back to MODA and said we like the Lake County report to be separated north and south. We used to get both reports that way, and I got an automatic reply that says I'm on maternity leave, and so we're not going to get that for a little bit, but I will produce this report both north and south. I know the people in the Christmas Valley Clinic, there's a page here on how people use specialty care, and that has been a concern up there after last month's meeting up there. The referrals or ability to get into specialists in Bend has been reduced in their view, so
Oh, we need to know about it.
we'll see what's happening.
Good, good to
So,
know.
I don't know how you're gonna do the driving here, just go, I'm gonna just do some highlights here, because there's other,
You want the
once we
mouse?
get the other,
Well, do you want the mouse?
once we get the other reports, then you'll have more questions about it specific to your service area. So basically what this report does, we get it annually, is it describes how the EOCCO pays claims and what money we get to cover those claims. And this data is all about Lake County as a whole. As I said before, we will try to split it out once Liz Edberg gets back. But it really paints a picture of how the spend is and what people are doing. So,
Should do.
Just have to scroll down.
okay. I can do that. Okay, we're not quite getting the whole page here, but basically, the total spend for the EOCCO was about $9 million for the 1,683 members of the EOCCO here in Lake County. Basically, it comes out to about $5,351.86 per person. So our average was 1,683. You can see that the average membership was actually down 3%, but the total spend was up 7.1%. At the bottom, it's hard to trace with so many lines, but basically the mental health spend, which is the gold line, and the dental spend are always going to be consistent because they're all capitated. And then what fluctuates is the inpatient use, and we had a great big spike in February of 2017 on the entire system, and we're thinking it was because of influenza. Hospitalizations at that point in time. This is just the total services provided. So on this number over here, prior services total, you can see that we went up about 17% in total services. So on another page here, I'll point out that a lot of those are single x-rays or lab tests, those kinds of things. So here is the service area category detail. We can see how the columns work. This is inpatient care, 1.5 million was spent on that. We spent about $74.64 per member per month, and the change is up 64%. So here's where the services, this is paid, no, I'm sorry, it's the next one will have it. But you can see here for primary care, we spent $420,000. We gave each of the clinics in North Lake and here that are PCPCH, the payments of about $284,000. This particular page, and Arvinder, I'm not sure if you sent this out for people if they really want to look at it, but it tells you a lot of information that's pretty interesting. Let's just go down here to children 0 to 1 year old. Each of these categories, we get a different payment rate for them because they're at different risk levels. And you can see overall we had 47 kids from 0 to 1. The budget per member per month that we got for those kids was $513, but we spent on every month $892. So you can look at any of the categories and be able to compare where's the spending, or where did we actually save funds.
So what does that mean if it was budgeted for that and it came in at that? Who ends up paying that difference?
Well,
EOCCO?
yes,
Okay.
but But you can see that some of them we got, like, for instance, the blind and disabled who are Medicaid only, our premium per month is $1,400, but we only spent $921. So it depends on what you're doing. I mean, the whole concept of insurance is that you have a big pool of people, and some are going to be more costly than others, but we try to estimate the actual money that was there. And again, we've asked for this in the past. We have the medical spend, the dental spend, pharmacy, and mental health. This is all new data that the Regional Community Advisory Council has requested as part of these reports. Key indicators overview, we'll skip that one. Here's the emergency utilization report. Lower left is what we're going to focus on. These are, we had 1,683 members, 1,249 of them never went to the ER.
Wow.
We had, who had one visit, there were 278, 2 visits, 98, 3 visits, 29, 4 visits, we had 16 people, 5 to 7 visits, 12, 1 person that went 8 to 10 times, and 1 that went 11 to 20 times. So what we really need to focus on are these people that are 3, 4, and higher, and we look at our case management people would get a hold of these folks and try to determine, and working with local clinicians to figure out why is this person not coming to their patient-centered primary care home and save on the resources that are spent there. The interesting part too, though, is the bigger users, your 0 to 1, and then people over the age of 75, which is consistent across all of the EOCCO. Here's the primary care utilization report. We were interested in this number right here, where the cursor's moving. It's out of our 2,700 people, or whatever it was, 1,700 people, 644 of them used no primary care. So the question is how are we supposed to provide preventive health screenings and services to people if they're not in? So that's where we run into problems meeting the incentive measures when a full 38% of our members never consume any services.
But it was
56 before.
quite a bit fewer of them. So we are reaching that population.
Yes, and as a CCO as a whole, we're at about 35%, and it started off in 2013 at about 26%, and it just keeps climbing up. So one of the things that would happen there is we got to figure out how to turn that. So then, all the time when we would say that, people at the LCAC meetings would say, who are these people? So this page presents the members who did not have any primary care utilization by their age and gender, and then which clinics those people were assigned to. So you can see that a big grouping of the people that didn't come were 5 to 14. We need those for the adolescent well care visits and convincing parents that it's a good annual visit to use services, and then probably healthy 25 to 44-year-olds who don't seem to want to come in for anything. But you can see that of that number of people, 395 of them were assigned to the clinics run by Lake District Hospital. 160 were assigned to the Lapine Clinic. And then some of these other interesting ones, I don't know how they get assigned to Grand Run Hospital, Charlie. Who would pick that as their PCP from out here? Then obviously they didn't go.
It's someone that used to live up there and has never transferred.
It never changed.
Yeah.
Same thing with Blue Mountain Hospital?
Yeah, Harney.
All of them.
Well, look at Pendleton. You got 2 there too.
So on that note, that's one of the things we've done is gone through our list and checked who their PCPs are. If we're seeing them, we've reached out to them to say, look, we can offer you better care if you're going to continue to see our clinic, to go ahead and get your PCP updated and help them out with that.
Yeah, changing the providers is not hard for plan members at all.
Yeah.
For
Just a
dental,
resource.
or for, go ahead, Shelley.
Oh, we tried several times. Sometimes we've been successful and other times it's been difficult. We've tried to ask EOCCO for lists. My recent one was students from 12 to 21-year-olds to get them in for their annual wellness exams. But a lot of times when we try to ask EOCCO for this information so that we can call, we can mail them information, we don't get a response. So that's one of the barriers that we're experiencing when we're asking for lists of patients so that we can reach out to them. Sometimes we can get them and other times it's quite a struggle.
So they send you a report on a quarterly basis that has that information in it. I don't know who it's directed to up there at the clinic, but I can find that out for you, Shelley.
Okay, that, and I also utilize my incentive measure report because it always details out which plan members belong in each bracket. So like the adolescent welfare visits, those patients are all lumped together on a spreadsheet.
I think the ones that I'm seeing are the ones that we've seen that have been seen at our clinic, not the ones that haven't been.
Yeah, that report will identify which plan members need which services to meet the incentive measure. I can see who it's sent to. Maybe it's the right person's not getting it, and it is protected. You have to go through several steps to get into that database.
Right, and we do receive those, Marie Maines, the COO, and I do receive reports, but when I look at the report, it appears that they're just patients that have been seen at our health center, not the ones that haven't been that we're trying to reach out to.
Mine are all mixed together.
Yeah, whether they got the service or not.
Right, it's
Yeah.
all my assigned members show up.
Okay, I'll take a look at it again.
But if you have a specific data request, please go through me. I can try to get things that we want. And then this is the page that I was referring to up north that they were interested in. How are people using subspecialists? And you can see where the people are going. So it's all over the system here. And the biggest use is orthopedics. That factors affecting health services contracted state is like a catch-all group. Inpatient non-maternity, where are people going? This is by paid claim, so 38% of that inpatient paid claim went to OHSU. You can see 32.5% here, and 23% up to Penn. And again, the reasons for those visits. Then these are the pharmacy reports. I'm not a pharmacist, so I'm not going to try to pretend to be one here, but I do want to point out that the biggest group of scripts is still opioids. 1,747 scripts written for Lake County residents. And then lastly, this is just the demographics of those 1,683 members, so that when Christie's and Arvinder are sitting down to grants and you're trying to figure out how many members are a certain age or gender and those kinds of things, you have that right here for data. That's it. Again, I'll try to get the other reports when Liz comes back. My other item on the agenda was focus groups, and I want to thank people who sent me names and contact information, and I'd like to know if there's any reason why Thursday, May 24th won't work to conduct a focus group in Lakeview over the noon hour. Does anybody know of any big conflicts or anything?
So it was the 24th, you said?
Yep, Thursday the 24th.
Where would you do that?
Well, I would check with the senior center. They have a little room off to the left It's kind of private, where we work for the 12 to 14 people.
Yeah.
But they
If
can
they're-
let us know if we're part of that group.
I'll be sending out the invites. I'm trying to balance it between males and females and other things, and we'll invite as we go, folks that we're looking for. So now that if I can secure that place, I'm gonna try to run that focus group that day. I'm still working on a time, and Kathy Pike up at Lapine has provided some names. I knew some other people from working up there over the years, but looking for a time to do that over the noon hour up there sometime in May as well. Thank you.
Any questions of Paul? That's a lot of information. Would everyone like to have a copy of this?
I
We
would.
could email
Yeah, I would.
Our vendor
And
would-
send it out
Yeah.
over email.
is,
You have to make me a copy,
Yeah.
please. Sorry, gotta be one in the crowd.
You can have mine.
Oh,
I
okay.
have an extra copy.
Okay.
Thank you. Yeah, thank you.
it makes us, one of the things that it does is it helps us realize how money is being spent.
Yeah.
And then areas that we can, like the person that was going to the emergency room that many times, if we would
Yeah.
impact that by helping that person figure out what was the reason for that. That could change the dynamic of how we spend other money. So that's really important stuff.
And sometime we have to because we can't get into to see the doctor. They send us to, they say, if you have an emergency, you go to the emergency room. And if you have a bad cold suspecting pneumonia or something, you gotta make it over there.
Right, and that's one of the reasons why each of the clinics here in town do make available as much as possible the ability to take patients on a quick serve,
Yeah,
sort of
yeah.
a walk-in basis.
The walk-in one is great, yes, very good.
Because the rules are different, right? The rules for what happens after you leave an emergency room aren't there a bunch of rules about how they have to be treated and what has to happen with them if they can't come back within a certain period of time, or you get marked against it or something like that?
I haven't heard that.
Marked against the hospital.
Yeah. Marked against the hospital.
Readmission.
Yeah.
Yeah,
But that's-
Well,
yeah.
that's not,
Yes,
you're
it's
not,
different,
you're not ever admitted when you're at the emergency department. You're not admitted to the hospital.
Oh, okay, thank you.
You
Oh, I
use
see.
the services as an outpatient, you leave. You can come back twice the same day. I don't
And it
know.
wouldn't matter, okay.
Well, it does, if you're going to the emergency room twice in a
Yeah.
given day, generally speaking, the first visit wasn't as complete as it should have been.
Yeah.
And then if you have an opportunity to be seen by your doctor, instead of being seen in the emergency room, more often than not, that's a better environment. Even though it's difficult to get into some of the doctors when it's a high pressure time. And it's difficult if the patient needs to be seen at 5 o'clock and the office is closing. So sometimes we have to try and figure out how do we help both the patients get in to be seen at a time that works for them, as well as a fair time when the clinics are open. So,
An example, my wife was dealing with high blood pressure that was unmanageable at the time, and so she ended up coming into the ED. And so they set up an appointment for her to see her doctor afterwards, after she actually spent time in the hospital, in the CCU and everything. And before she could see her doctor again, she was back in the ED again with her blood pressure really high. And the ED doc was going to discharge her. He says, well, there's nothing we can do here. And at the time, her friend was with her. He says, so, you're going to discharge her with her blood pressure as high as it is. That means we're going to be back here in about 2 hours. Is that what you want? And he said, oh, I guess not. And they changed her medication right then, dropped it down, gave her time to see her doc then the next day. And at that time, we insisted that she go see a cardiologist, and as a result, it's been managed now. But she could have been there 3 times within a couple of weeks, easily.
Yeah.
She would have been one of those statistics better.
Thank you for that. So I hope your wife is doing better.
Doing much better now. Yeah.
I will point out, Charlie, though, that as part of, we're qualitative part of our community health assessment is the focus groups, and then we're bringing data in. But one of the things that we are looking at is something called ambulatory sensitive conditions, which are reasons for admission to a hospital for things that can or should be managed in primary care. So there's a whole list of diagnosis codes and admit codes that John Billings out of New York University has identified. So it's just another way of measuring why are people coming in. I mean, being hospitalized for hypertension is one of the ones that's avoidable. Being hospitalized because you're in diabetic shock is avoidable if they're being managed properly in the primary care setting. So it should be interesting to see what the numbers look like.
Do you already have your focus group formed?
No, I'm forming it
Okay, I'd be interested.
early this week.
I think, if I can do it. I'd have no medical degree, but I'm always willing to help.
Thank you, we appreciate that.
Mhm.
We appreciate that a lot. Moving on, Alana, now is your opportunity to shine.
Okay, well, I have copies of our update. I don't think I have enough for everyone because my printer, I apologize for the printing quality. I go through a lot of black toner and evidently I did not have a backup and my printer decided to quit working today. So it's somewhat readable, but our update is pretty similar to what it was last month. We just my Healthy Happy Smiles program, right now I'm just attending a lot of health fairs across all our counties, getting toothbrush kits out again before the summer. Mental health first aid, so as of today, we've provided 20 trainings. There was actually a training today in Harding County, and we've trained, since October, we've trained just under 300 people in mental health first aid across Eastern Oregon. So that was pretty exciting for me to see those numbers. And then all the other programs are colon cancer, integrated nurse home visiting, and then our obesity, social marketing. We're all kind of in the beginning stages of those, doing outreach, really getting them on the ground and running. So, yeah. That's about
Of those, which ones are impacting us here in the county?
Mental health first aid is right now, I think, the only one that we have done in Lake County. And I don't directly work on the colon cancer, the integrated nurse home visiting program. So I can't speak to whether or not they will, but I do know the obesity campaign. I think I'm going to be working on it, so I'm going to try to do some convincing so that I can do some of it here. Right now, our target populations are Morrow, Umatilla, and Malheur counties, but I think it's going to be a fun program where there's a hiking, I think it's called Hike 30 or something that we're looking into doing. And if we do get that up and going, I want to do it in Lake County. So.
Well, we're happy that Malheur or other counties are having these programs, but mostly we are interested in what's being done for Lake County.
Yes.
So as of right now, it's just the mental health first aid. Hopefully, we will be doing a youth mental health first aid training with school staff in the fall, since we're still in transition period when it comes to staffing. We're just going to kind of wait until they have all of that set and are ready for the next year. I'm hoping at staff in service. My goal is to get 100% of Lake County School District staff trained in youth mental health first aid. And then ESD staff as well will be invited. if they're interested.
Well, and I know staff members from also Extension Office, we would like to go.
Yes.
And also, I'm wondering, which falls underneath ESD, but the Lake County Mentor Program,
Okay.
and the mentors who are working with these high-risk
Mhm.
populations. So there might be opportunities for several trainings if we kind
Yeah.
of, if you're looking a little more broader.
Yeah. I think to get all LCSD 7 staff, we would need to do 2 trainings anyway. So the trainings aren't too big.
Yeah.
So, but yeah, potentially we could even do a 3rd with all the mentors and everything.
Good to know. Questions of Alana? Other than? Thank you very much, Alana. Our vendor, an opportunity for you to shine.
Thank you, Charlie. Good afternoon. My first update is about there are some developments with the telemedicine project. So I spoke with the Paisley School District Principal, Mr. Paul Horder, and spoke about if there was a mental health need for students and if we could set up a telemedicine equipment at the school. He seems very interested, and he said we should definitely have further talks on establishing a telemedicine setup at Paisley. Then I and Christy later met with the Lake County Sheriff, Mike Taylor, and discussed the possibility of setting up the telemedicine equipment at the jail. He said he is interested, however there are lots of details that need to be worked out. And so we have a meeting set up with the sheriff and his staff tomorrow and early next week. My next update is about the Living Well classes. So we are into the 3rd week of the Living Well chronic pain classes, which is taught by Janine and Fancy. And Janine is also leading the diabetes workshop. Janine or Francie, do you have any, can you just give us any idea of how the classes are going? Is there a good turnout?
The diabetes support group is going well. Our next meeting will be May 14th, and we'll have a cooking demonstration, and we'll be working with healthy snacks, so it's going very well.
Thanks.
Had a lot of people see the article, thank you Jimmy, in the paper, and call and ask about it. Cool. Would you like to speak?
No, the chronic pain classes, thanks to Janine and just the wonderful referrals that we're getting from our closed loop system, as they say, we're starting off full, quite full. Sky Lakes Medical is like, wow, you guys are rocking it over there. But I have to say that they dropped off. We went from, they started at 21 or something were signed up, 15 showed up, then 10, and then 4, and I'm like, whoa, you know, and it's not always been that way. We've had a much better retention rate. I think this is the worst retention that we've had so far. And the September program is already full. So it's interesting. I think that, you know, we want to really try to work on getting them to commit. I don't know how to do that. We don't have incentives for chronic pain, except here's your book. Now give us back the numbered library book so we can keep that library going. And aside from that sometimes they're being required to do it by their physicians. But I mean, the people still really, they say good things. We have people in there that say, you know, I've had this for 18 years and I've never had this much information help me deal with it. And so I think that the word on the street is really good. That's why they feel so well. But this particular time, I'm like, wow, this is kind of tough.
Reggie, isn't there a recommended number of people to start? I've
Yes.
never heard of 20-something.
Well, there's a recommended number. 20 is higher than they really,
Right.
but we also know from experience that 21 won't show up. We're prepared for them.
Right.
But we know that they won't show up, and we want to end with a good retention. And in the past, we've had, I'd say like half or more, depending on when you're talking diabetes and chronic pain, they kind of, like, I do both, and they're kind of mixed up in my mind a little bit. But we have a decent retention rate most of the time.
But with a group that big, they may not feel like they're getting any kind of personal attention.
That many didn't show up. 15 is definitely within the realm of living well. Not that's not I don't believe that's it. We're unfunded for chronic pain, so we don't really have snacks. I mean, once in a while I pull out of my prevention budget. And snacks is a big thing, in my view. But we just have the program, and like I said, this has just been the worst. I don't really have an answer.
What about time frame? What time of day is your class being offered at this time?
Well, because people requested it, we start at 5:30.
Should be a good time for you then.
We've had it before at 5, but somebody said it was just too hard to get dinner. They got off work and they were running, and yeah. I mean, if it was as easy as just figuring, I'd love, okay, we won't do this anymore, but it is still well worth it. I mean, one time, this is our 3rd time, and we've been running them back to back. So it's our 3rd one since when, Janine? Since when did we start them? September? Okay, so this is our 3rd one since September. So that's a lot of people and run through. Plus, we're also running diabetes, which is run twice so far. And now we're certified in chronic disease, so we'll be starting chronic disease self-management, which allows us to do cancer patients, asthma, depression, hypertension. Yeah.
When's their class then?
We don't know yet.
And Jenny, for the cooking demonstration, are you gonna get somebody to do the demonstration, or?
I'm gonna do it.
Oh, you're
Yes.
gonna do it.
I love it.
And I had a question about the Living Well classes. Like, is it flexible enough, for example, if we get a dental hygienist to, during one of the days of this 6-week sessions, and they can talk about, because we were having a discussion earlier with people at, okay, so we can't do that in the Living Well.
You can have resource stuff on the resource table. You can have something after the class if somebody wanted to stay after, but your license, and our license, we're under Skylake's license or under AAA's license, depending on which class, and those licenses don't allow you to do that kind of stuff.
However, we can do it after the class?
You could do it after the class. And the next class is in the afternoon, so that might make work better for that kind of thing. Or you could do it before the class. Yeah.
And all the participants have good faith in both of you, so if you tell them to stay till midnight, they will.
I think if you had snacks, they would.
We can work that out. Well, thank you, Janine and Francie. Next update I have is about the summer lunch program. So we have started scheduling, so Brooke and I are calling up all the school children who are interested in being the junior buck leaders or the site monitors or the school volunteers. So we have scheduled interviews next week during Monday, Tuesday and Wednesday. I think we are still making calls and setting up what time. We have a window between 2 to 6, and so we are scheduling calls for that. And a month from now, the summer lunch program will be underway. So just wanted to remind the council about that. The next update is about the youth triathlon training. Yesterday, we had the second meeting regarding the youth triathlon training at the OSU Extension office. And just to remind you what this is about, this event is designed to combat childhood obesity, which is one of the incentive measures that Lake Hill District has decided upon. And the idea is by increasing the physical activity of youth, by engaging youth and families in a weekly educational workshop related to health promotion of youth. And to prepare the youth who take part in this training, to prepare them for the annual Lakeview Triathlon that is held. And so these are preliminary meetings. We decided basically what the name was going to be, how the logo should turn out, what day of the week we were going to teach. We're going to train the youth. And the idea was, and I'll just hand out the rough logo that we have decided upon. And we also plan, so each week a new workshop will be offered at a location which will be conducive to the topic of the week. And so there are going to be, I think there's going to be one more meeting before the end of this month. And yeah, so we are working out the details for that.
When is the triathlon?
August?
August 12th.
August 12th. And I guess in yesterday's.
So they got time to get ready,
Yeah.
is what you're saying. And what's the distances on the 3 events?
It depends on the age of the youth participating.
So it's a sprint triathlon?
It's a sprint triathlon for adults, but it's shorter distances for elementary age youth, based on their age range.
I don't know what a sprint was.
A sprint for adults, I'm forgetting how, it's like 10 laps in the pool, a 13-mile bike ride, and a 5K run.
Oh, okay.
And so, like, the kids are like a half
As
mile
opposed to
run or
running a
mile run.
marathon distance.
Right. I know it's not Ironman, but I was just
It's
curious.
just really short. So the Home and Health Hospice puts it on as their outreach event, and to encourage and kind of revive it, they added this really great youth component. So that's what we're gonna help encourage youth to participate in and train for over the summer.
It's widely excited. Lots of kids like to participate.
What date, excuse me, what date was that again?
August 12th is when the
Well,
triathlon is
okay.
actually held on.
Okay.
But we'll have 7 individual sessions leading up to it, so weekly sessions where the kids come
Yeah.
together and learn.
Okay.
And for now, we have decided to start the sessions on June 19th,
I think June
Oh.
26th.
June 26th, and it's a Tuesday.
It is right now, but there's a lot of moving parts right now. I have to have a request into town council to make sure we can use the pool and the pool park, Mr. Optimus Park, and then the high school at the track. So definitely I'm apprehensive to say about what will be on, because we have to have 7 different locations and 7 different facility use approvals. So, but hopefully by next meeting, for sure I'll have everything ironed out by next meeting.
And we have the Milk Matters Day tomorrow at the school, so Brooke couldn't be here. She's preparing for the Milk Matters Day at the schools tomorrow with the kids today. And so that is all the CHIP updates I have for today.
Thank you very much. Now is an opportunity for each of you to talk a little bit about your organization and things that are going on. So Rob, let's start with you rather than end with you.
Okay. Well, we had our collaborative meeting this morning, and at that meeting, that's older adult collaborative meeting. At that meeting, we had a couple different presentations there. One was on the Villages Northwest, which is looking at ways to help seniors age in place. If you're ever interested in that, villages are popping up all over the United States. You can go on the internet and look at that. And so we're looking, what would that look like for Lake County? So we had a couple of representatives of Villages Northwest talk to us and discuss, begin ironing that out. And if that's something that we would choose to pursue here, that we'd have to do a lot more investigating. There are some rural communities that are doing it, so opportunity to see what they're doing there. We also had Todd Troutner, who is the head of our senior peer outreach program that we have through GOBI, talk to us and share with us more about what that's involved in terms of providing an opportunity for seniors or those with disabilities to have someone give them a call every week, and how that really makes a difference in their life and help avoid social isolation. Let's see, we're getting ready for the daily days. This year we're going to have a couple of tables specifically focused on senior needs. And let's see, what was the other piece? Oh, on June 15th is the violence.
Elder abuse?
What's that?
It's the World Elder Abuse Day.
Yeah, and so they're going to be focusing on addressing that and helping people become more aware of elder abuse in the community. So that's some of the things that our collaborative is focusing on. Last month, when I was here last time, I was able to work with Lakeview Gardens as well as what's the name of the other group here in town? Kindred Circle Care that provides home caregivers, provided training on positive approaches to care. We had actually 35 people in attendance in that. A packed house. We will be providing further training in that area on positive approaches to care probably later this summer. And I've also now become a trainer for Oregon Care Partners. And how that is a benefit is, for instance, the positive approaches to care that we're providing, Oregon Care Partners will now provide the CEUs for that, as well as when I do go to different places in Eastern Oregon, instead of just be paying for my mileage and travel expenses, Oregon Care Partners will do that. They're signing a contract with Gobi as we speak. So they don't have anybody in Eastern Oregon. And I reached out to them for the CEU piece, and they said, hey, we'll help cover the costs because that's a huge need. Already this last month I did 5 different trainings, and they said I was going to places they hadn't been to before. And I said, well, that's what we do. And so that's going on. I will also get trained by them to provide the certified training for nursing homes and care facilities. So that's going to be coming up as well.
Where is Oregon Care Partners based on?
I believe in the Portland area. It's on the west side.
Okay.
Yeah, I'll have to look up where she's at, but Angela's the person I've been reaching out to. I reached out to them again for the CEU piece, and they're supposed to be providing some of this training in the rural areas of Oregon, but they don't have anybody surprisingly out in those areas. I said, well, that's on at least the 8 counties that I serve. I'm in each of those counties at least once or twice a month.
Marvelous. Questions of Rod? Anyone?
Not a question, just to add to what Rod was saying about the June 15th, the World Elder Abuse Day. We are planning to hold a barbecue at Senior Center, so everyone's invited. And yeah, just thought I'd share that.
Okay.
What day is that again?
June 15th.
June 15th to bring about information on elder abuse.
Yes,
Yeah.
and it's a Friday.
At the Friday, okay?
And that includes making the screen too small for people to see.
Yes.
I'll make a note of that.
Yeah.
I have a question for Rod. Are you working with the folks out in Christmas Valley at the Outback Retirement Center yet?
I actually swung by there, but I haven't had a chance to make the connection for that. I was just thinking about that. I would love to be able to provide that training up there.
Because I'm trying to begin to reach out and talk to them. And there's a couple of other agencies here that actually need to also be there. And we kind of made a vow that we were going to try to make some summer trips, road trips up and go together, so that those folk, we got their concerns and everything. So maybe we can touch base on that. Okay?
Yeah, we can talk about that afterwards. Love to do that.
Yeah.
Great. Thank you very much, Rod. Brooke, welcome.
Thanks. I was out at the school.
Crying over spilled milk.
Yeah, actually, I didn't say that. We're planning a milk promotional thing for tomorrow, so.
Do you want to give us a little bit of an update on
What I've been doing?
all the stuff that's happening with you?
Yeah, well, I've just been in the classrooms again like normal. Let's see, tomorrow we have a milk promotional thing going on out at Union at Westside for all the kids. So that will be fun. We have 2 field trips coming up. Again, kind of milk promotional things. We're going to a dairy farm in Klamath, so that'll be the 2 Fridays after tomorrow. It will be the 4th graders in town, and then all of Union School will be doing that. So we're excited about that because there's definitely, a big trend going on that some of the cafeteria staff have noticed is that the older elementary school girls do not want to drink milk. That's a new trend, which is okay if you're, supplementing with calcium and vitamin D, but they're not. So that's kind of one of the big things that they really wanted to promote. So
Got
we've been
the
doing that.
chocolate milk.
Yeah, we do. They have chocolate milk, and even still, they won't take it. So
It's a trend, is that?
yeah, it's like the cool thing nowadays. Yeah. Drink coffee and
Yeah.
stuff.
Things that we didn't know.
Really?
Making ice mocha.
Yeah.
Eberhardt's Dairy out of Redmond was providing school milk, but they provided the 2% milk in a blue carton and the whole milk in a pink carton. And when we did a research study in Matters, boys would only take the blue milk, and just the packaging makes a difference.
And yet, when we went to do positive actions in the classes and I gave out pens, the #1 pen color was the pink one, even for the boys, which totally shocked me. I'm like, what? This is against the trend you would think. I had no more, we were digging through the bag, they wanted all the pink pens.
What was the age of now?
4th?
Yeah.
Yeah. 4th grade.
But even, those 4th graders. Even now, like the milk cartons that they get, they have jokes on the back and stuff like that. But one of the problems out at Union is the milk distributor will no longer bring the milk out there. So the head cook out there has been coming into town to get that milk, and now it's just become too much, so they've had to switch companies, and the kids refuse to drink this new milk.
They do
I'm
not
sure
like, it comes
up.
up as parents club, like the kids just will not drink the different kind of milk.
Yeah, so we're gonna do a taste test for them, having the old milk and the new milk. And even if they can tell the difference, we're just gonna lie to them.
Well, I'll tell you, growing up on a dairy, what the cattle eat.
It makes a difference.
Yeah.
No,
Absolutely. So that's why we're kind of trying to really, and then having this milk promotional thing tomorrow, and then following that up right with the field trip, trying to really stick it to them, talk to them about the importance of it, especially because they're growing. So yeah, that's the big thing going on right now.
Great.
Yeah.
Thank you. Alana, did you want any more, or you set it up?
Got it, I think that will.
Paul, any more that we should know?
2 things. I promised the people in Harney from Tuesday, did the Oregon Health Authority ever schedule the community health assessment training?
No.
Yeah, so we did a doodle poll.
Right.
And so the dates I decided on was May 22nd to 24th, and their trainers were not available. So Mr. Tom Cogswell gave me new dates yesterday of 3 dates in June. Because I asked him then what dates are the trainers going to be
Okay,
available.
can you loop me in, because there are several people in Harney that want to come down for it.
Yeah, so I'm planning to send out a new doodle poll with the new dates, and yeah, so I'll also forward you the mail.
I forgot to mention one other thing, minutes before the WISE training that Christine Newton has been provided. It's gone through 4 sessions so far. I think about 9 people have been attending. This last one was on medication management.
Oh, yeah, WISE, yeah, very good class.
So you've been attending that?
Yeah.
And and it's helping those seniors that are attending it, for instance, that particular session,
Yeah.
even to be more assertive with their providers in terms of addressing their medication.
Yeah.
So that's 4 of 6 sessions that they've done so far.
Yeah.
So that's-
Marvelous.
Okay.
Then the other thing is the Regional Community Advisory Council meeting, and you guys will like this, is in John Day on June 26th. So that's about as close as we're going to get.
John Day?
Yeah.
It's only about 3.5 hours from now.
3?
3.5 to 3.25.
Make it 3.
I do about 3 to 4.
Oh, depending on who's driving.
Okay, so, well, you can tell that we get invited to really close places. Anything you'd like to bring up, Susan?
We are settling into our new clinic space, so if you haven't stopped by to check out our new home, come and see us.
Oh.
So we just were able to move in about a week and a half ago, so still working out the bugs, but loving our new space. So.
Marvelous.
The
One
waiting
thing I
there
have
is
is I
beautiful.
came to the doctor and got lost.
And unfortunately, it will get worse before it gets better, but we're all around to help guide you through.
Speaking of getting lost, one thing that those that are here, you want to tell your neighbors and friends, starting tomorrow, they're going to change the corridor between Dr. Graham's clinic and the hospital and our clinic. They're going to work on that clinic in that hallway, so they're going to block it up.
Huh.
So
Again?
you don't have to walk outside, even though the weather's nice. They created a little tunnel right next to it.
Is Nolan Nicole in that town?
It is-
An opportunity for
That'd be a great promotional thing.
We have not yet thought about painting it pink. But maybe not a bad idea.
Yeah, maybe.
Anyway, it'll be about 2 months while the contractors are working on the corridor and trying to make the adjustments that they need to do, because now that they're working on the the former clinics, specialty clinic and where Lake County Medical or Lake Health Clinic has been, that's all being changed. So it'll be a little confusing, and we do apologize for that. But understand, just have to deal with our mess, and it will come out better at the end of the day.
There'll be lots of signs.
Good.
It's super confusing though. I was gonna suggest that you guys have a person, but if that's all gonna change, because
It's all
there's
changing.
4 or 5 people lost every time I walk out there. So,
Well, and that's today I started shutting the door and it says check in at reception because people were just wandering in lost, and there's no people when you first enter right there. It's just
Was that
workplace.
part of the staff that lost?
I did hang signs in front of everyone's office so the staff could find the people that were looking for us. But actually I had one lady go through today and she's like, you should be proud of me, I didn't get lost this time. Yes, people are adjusting theirs.
Do we still have to dodge the lights yet?
Dodge the lights.
Yeah, because they didn't have lights and they had all of the cords, and you walk in there, you kind of go down like this.
Well,
Lights were tied up inside there, but they didn't have them all done.
hopefully no one's tall enough to hit that. We don't have any basketball, NBA players here, or if those of you remember Wilt Chamberlain, he would hit his head.
Right.
But they are temporary. We apologize, but it'll be much better when it's all done. So
And you say that's gonna be for about a couple of months?
it will be. It may be less, but
Probably more. No, I'm kidding.
Really good.
What I'm suggesting is you might check with the auxiliary and see if they'll help you direct these people,
that's a great suggestion.
as we did before when we first remodeled over here.
Well, we're just about to that, let's see, the time of graduation and the time of holidays. And the weather will be nice, at least we didn't pick a time when you walk outside and it's cold. So that's a great suggestion, though, thank you very much.
Yeah, you're welcome.
Janine, would you like to add more about your Living Well program or other things that you're supporting?
Well, just wanted to add that we're getting excited about starting the next Living Well program, which is the chronic disease self-management. So that, we just have to schedule that, so that's coming up.
Okay.
Marvelous. We appreciate that, that's really great.
Uh-huh.
Judy?
What's new? I had my first site visit and I did well, very exciting.
Congratulations.
Thank you. We got the OHP grant. I'm very excited, found out today for sure. So to continue on doing the sign-ons for OHP and research. So we got that grant, $100,000.
Oh, right.
Very excited.
Yeah.
So that was good news today. We're still moving forward with the hospital. Hopefully it's progressing. I'm hearing more and more talk, so maybe looking at July 1st if all goes well on that. That'll be a new exciting change. All my staff is staying that I know of, so I'm excited about that. I was worried. And my boy's graduating, so I have that in the next couple weeks, so that's very exciting. Yeah, so life is good for me right now.
That's good, yeah.
Francie, anything you'd like to?
Well, living well is all going well. My prevention stuff that's more direct is kind of, winding up as May goes through, so that's nice. I get a chance to do some other administrative things. We've got the people that have agreed to go on the problem gambling community survey awareness, that we got that grant from the state for problem gambling. So that's coming up in June. We had just finished 12 weeks of doing life skills and yoga, basically, with the alternative school kids, and had a little celebration, and we were there twice a week for 12 weeks. And it was really, really great. They were like, "You're like family, It was lovely. They're just really a wonderful and underserved, group. And that was, it's kind of sad to let it go, but it frees up a bunch of time, which is awesome. So just looking forward to the summer with the summer park program and all the prevention stuff for living well, and yeah, great. Trying to get some of those things like reaching out to other parts of the county. And, we did get Paisley, got back to health. And this was really cool because we went out to do a sample class and a question and answer session to see, because we had someone who advocated for us to expand this program out there in Paisley, and we didn't know how many people would show up. And they wanted the class, but they couldn't pick a day when I was available, so it turned out they had a lady that is a senior who has written a book and has been traveling all over giving classes and taking classes. And we had Melanie Losky, our physical therapist, who's also a yoga teacher. And they both are teaching the Back to Health together out there in Paisley.
Cool.
And they had 19 people the first class.
Right.
The majority from seniors. And then some of those ladies really needed just chair yoga, so they decided to meet an hour earlier with the senior lady that does that. And then they still had like 15, and then it's gone down. So now it's kind of settling in around 10. That's pretty good for Paisley. So that was really cool, and I didn't have to, I love to teach, but I didn't have to do it myself, so it was a good lesson. You don't have to do it all yourself. So yeah, everything's good.
Good, thank you. Dayla, there's so much going on.
I don't know if there's that much going on. I know we have the athletic physicals coming up. Yes. Just getting everybody in. I was going to try to get over there with Susan and make sure that everybody's on board for those on the 23rd from 1 to 5.
23rd?
Yeah. 23rd.
May 23rd?
Yeah. May 23rd, 1 to 5 with Bobby.
So we haven't rejected sports physicals here.
It's going to be a tough change to make with her. I'm not sure.
I don't know that Bobby will ever.
No, but I'm not so sure we have very many more years to.
Yeah.
Oh, okay.
Yeah. It's going to be a tough change to make.
It's worked well some places, other places there's been, it's a slower transition to make the adolescent wellness.
It is, and it's
what
worked
we
for
need
her.
more than anything is the OSAA saying that all kids should have an adolescent well
Yeah.
visit. If their policy was that, it would be
Easier.
Yeah.
Well, we still want to get our physicals to the kids and.
Yeah, we are going to do the Pop Warner in-house.
Okay.
In both offices, I guess. She was more than willing to do that still. So
Good.
that helps. I think at least you could screen those younger ones.
Marvelous.
So that's about it.
Thank you. Mary Ann, you want to talk about what we were discussing earlier?
Sure. So I met with Charlie earlier and our vendor, and he was there as well, and we talked about looking at a possible pilot project of how we can integrate and work together, one, to increase utilization as a whole for the Medicaid population for dental, for pregnant and new moms, and diabetes. And I shared some ideas and things that have been going on in other regions, and finding ways that we can work together to communicate better on a two-way street where we're a little more integration going on. And so, do you want me to go into greater detail, Charlie, or?
Yeah, I think it's a great idea. And after all, this is something, if what we'll have to do is bring this up to the LCAC
Right.
to, if we do want to submit it to the CCO.
Right, and so really looking at, as a whole, I mean, dental utilization is not is nearly as high as we would like to see it, and especially in our older population. And of course, there's a lot of factors for that, dental anxieties, and just a whole lot of reasons why that occurs. And there's a very direct connection between periodontal disease and diabetes. It's a two-way street. You know, if someone has got severe periodontal disease, it's going to definitely impact their diabetic condition. If someone has diabetes, they're more likely to one, can get periodontal disease. Two, they're more and if they're a smoker, they're even more likely to start losing teeth. And so it's really that education piece between entities. So we talked about, what if medical was asking the question every time they came in the door? Have you been to your dentist? When was the last time you've been? Have you ever had a cavity? What if dental is asking every time they walk in the door? Have you seen your primary care provider? And really trying to get some consistent messaging going on both ways, really communicating, having a true, you know, truly communicating with one another and looking at total patient care. And we're really wanting to see that increase in pregnant women and new moms getting that education, not only for that first assessment for themselves, but the education on what they can do to prevent their child from ever getting cavities. What we can do, how, you know, and again, educating the diabetic population on how it's all connected and how there's definite connection between oral health and diabetes. And I'm very excited about the prospect of doing it. And I shared that a project that we're currently doing, a pilot project in Central Oregon, where we're going to look at doing point of care HbA1c testing right in our clinic and sharing that with our medical providers and really trying to make that closed loop referral system where, one, we're helping to get numbers and we're able to identify patients who are out of control diabetic condition and also possibly pre-diabetics and what we can do to prevent that. And we also talked about that. Let's look at an algorithm and just, you know, how we can determine those who are likely to be pre-diabetic and likely to develop diabetes if we don't intervene. And so I'm very excited about where we can go with this.
So, Mary Ann, I don't want to put you on the spot, but you were on the telephone at the meeting on Tuesday for Burns.
Yes, but I couldn't hear everything that was being said.
Okay, well, what they said was they can't get into the dentist.
Right.
And that they need more dentists, and it's about the same population as here. Yet you're saying you want to encourage more utilization here. Is that not, what's the difference between the?
It's our clinic. I mean, this is our.
Oh, you own the clinic?
It's our clinic.
Okay, got it.
It's not, yeah, it's not.
And are you active in Christmas Valley?
What's that?
Are you active in Christmas Valley?
Not currently. What we do have though is we have Tiffany that now will be going to the clinic there on a quarterly basis at least. And it's basically going to be dependent on demand. And we've been going there for a while, but we have not had great utilization.
Do you go to the Outback Senior Retirement Center?
No, we've been going to the North Lake Clinic.
The clinic. Yeah, the people at the retirement center are very much concerned about the underserved population, et cetera, and I just think that if folks are going and that no one's showing up, maybe we can help that somehow. If we need to move to be at a different place instead, as long as they're not going to insist on rent, maybe that's something else that can help and smooth the way somehow. So.
No, yes, that would be great. Thank you. It's a great idea.
Mary Ann, you brought up something that was astounding to me. How many of our CCO members are seen by a dentist or a dental hygienist at any given time in a year?
And historically, it's around 30%.
Say it again?
30.
30%. So that means 70% are not ever being seen in a dental environment.
And you also know that especially with the dental student metric and all of that, we're calling our patients. We're trying to get them in. And we just stopped at the clinic and phone numbers are wrong. We can't reach them. Yeah. Or they get an appointment scheduled and they don't show up. It's a constant struggle.
Can you get with me at some point? We have some stuff already going on with the prenatal visits, and that's part of the Bob Stroller program. But if we could get some contact information, and I have some other ideas possibly about some sealant opportunities.
Yeah,
So.
no, I'd love to. And you brought that up. And another thing I'd like to say is that Tiffany is a certified maternity for two trainer as well as first tube trainer. So if there's any interest in that, it's a great opportunity just at the very least to have a little bit more education in between pregnancy and so.
So one of the things that we're talking about is maybe as an opportunity for this to be a pilot project for the CCO to look at. In looking at the numbers that Paul showed us a little bit ago, about 30% of our CCO population are not being seen by a doctor at all. No primary care visits. Versus 70% are not being seen by a dental practitioner in some way, shape, or form. So if we can work on a plan to try and, in every place that we see people, whatever space, whether it's in Northlake, whether it's in public health, whether it's in a clinic, whether it's in a dental office, wherever, if we can be asking those kinds of questions, maybe we can change that dynamic and have them at least seen.
Yes.
That could have a huge impact on our diabetic population, on our kids. So we think, I'm impressed with the idea of trying to create, we want to have some metrics of where are we at today, what are we going to try and change. We want to have a lot of things that we could quantify. But I think, does anybody else have any?
They say you have to hear it, 4 times before you really remember it. So if I tell you the message is consistent across all platforms, the more times they hear it, the more likely they are to do it.
What I used to hear in the television business in rurals was they needed to see it 50 times and then they needed a call to action. So that your 4 is a lot better.
Yeah.
But that's what I used to hear at the television station. So we need to make a campaign that you can put, that goes everywhere. So not just a flyer, but a campaign that's all-inclusive, goes across. That'd be a great project.
And we could have a significant impact on our Lake County residents.
Yeah.
So I'm hearing everyone saying this would be a
As long
good
as we
thing
have
to
a
do.
facility that's able to, I mean, they're able to get in, and
Right,
they're able to.
and it's also, and that's one of the reasons we really like using the community hygienists, because they're able to go out to the community setting and provide services and get an initial touch and identify, is this patient low, moderate, or high risk? Are they urgent? Do they need to get in tomorrow? And assist them with doing so. And also, we talked about this earlier too, is that a lot of patients don't go for a lot of reasons. One, dental anxiety is one of the highest ones. So you take the clinic setting out of this equation and you get to see them at WIC or Head Start, or you're at the school or another entity. It takes some of that fear out, because when you don't have all the sounds of the dental clinic, you don't have the smells of the dental clinic, there's definitely a feeling. When you walk in a dental clinic, you could be blindfolded, you know that's where you are. and it gives that a different perspective, and it gives a great opportunity to really sit down and talk with the patient and just educate and
Create those relationships.
yes.
So Arvinder, can you just scroll up a little bit so that we can see the ages of the people right there?
If you have good information that is about that, when it comes to diabetes, we could put it on the resource table
Okay,
at
great.
the class. We can't promote specific businesses, but we can have educational information there.
Okay,
So.
that's good to know.
So Mary Ann, when you guys go into the schools and do your screens on everybody, does that count as utilization?
Yes. And we don't get to screen everybody because we're not doing passive consent. It's only active consent in Lake County.
So what about at the teen health fair?
At the teen health fair, that would count.
Is that going to be another booth?
They weren't on last year. I don't know if they did. Did they do sealants on site? Chrissy's not here.
Did she do screenings?
I don't think we were there last. Were we there last?
Last health fair,
They
yeah.
did. We had talked about it, but I thought.
Yeah, we had talked about it, but we weren't available
I'm
on the
wondering
day that
if
was
she
selected.
would be available to come do screenings at daily basis.
She's gonna be here.
She'll be there.
She's already signed up. She's
Awesome.
gonna be there and she's gonna do screenings.
Tiffany, would you be available to come to public health on days when, I imagine WIC moms are coming in any day of the week, but if you could schedule time to be available, would that work?
Yes, of course.
So,
And she's our WIC
That's excellent.
superhero. She covers Deschutes County and has done for quite some time.
I'm wondering, over at the senior center, something we've been doing now with, it's called the table talks. And that's where there's meals there Monday, Wednesday, and Friday. And we encourage community stakeholders just to come in and have a meal with the seniors. And while you're having a meal, at whatever tables you're on, you can bring up the health issues.
Right. That's a good
And,
idea.
and actually, through the collaborative here, it pays for the meal and so on. So that would be a great place for you
Might be,
to
yeah.
come and have a conversation with seniors.
That would be great.
And I think it'd be a good start if we could get something like that at the Outback Center. What John Effingham was asking me about was, did I need to cater in a lunch and do a talk with key leaders up there? And I'm like, well, I don't know, maybe, but I'm thinking more like a table, what you're talking about, would be a better start
Yeah.
rather than somebody.
It's establishing a relationship.
Yeah, I agree.
And
Yeah.
so, and in fact, those funds, this is Lake County, those funds would be available for that.
Shelley, are you still on the phone with us?
Yes, I am.
What do you think about this idea?
I think it would be great.
Awesome, and so we could be able to make this available up in Christmas Valley too.
And we're there quarterly
Yeah.
at their site, so we partner with.
Are you hearing, Shelley,
Yeah.
that patients are having a hard time getting in to be seen by a dental provider?
Not in our Lapine office. That's where they have to go in Christmas Valley is to Lapine. We work really well with the Lapine office, and we have a dental voucher program and so forth. And so they're really good about working with our patients and getting them in. Once in a blue moon, it'll fluctuate a little bit because they'll get, sometimes they'll get kind of backed up for they can't be seen for a month or month and a half or so. But for the most part, folks are getting in, especially those with abscessed teeth and kind of urgent kind of needs.
Great. Well, it sounds like there's consensus that us putting together a program to approach the CCO for some funding to do a study like this is the case. Am I hearing that from everyone?
Yeah, so you're talking about a study first to get the baseline before you actually try a campaign?
Oh, no, we would start the campaign.
Oh, you would, okay.
Absolutely.
Okay.
But that would include.
The data's already here.
Okay, yeah, that's why I was just clarifying, okay.
No, this would be to make a difference right away. And if this works well, as we think it could, have it as a model for other communities, other counties to do the same kind of thing.
I just put in an order, it has to go through IT, but for a video camera and a little accessory package and a handheld digital recorder, in which would give us the ability to create a piece on how this comes together and everything from the very beginning. Unfortunately, we don't have it at this meeting, and you could have something that you could post up on the website and whatever, and anywhere else on Facebook and whatever to begin to get the word out about this happening at Summer.
Thank you. Shelley, do you have anything that you'd like to add on what's going on with sorry, I didn't mean to interrupt.
No, I'm good.
Did you have anything else? Okay.
That's it.
Anything else that you'd like to tell us, Shelley, about what's happening in Christmas Valley?
Sure. Kathy Pike and I just Tuesday met with Sheba, so we're looking at options to get someone from Sheba down to Christmas Valley to help people with Medicare and how to enroll and just help them through the process and answer their questions. So we're looking at how we can move forward with that.
What is that acronym,
Sharon
SHEBA?
said, pardon?
What is the acronym SHEBA? I know the program, but I can see people looking here.
Oh. Hold on just a second here.
Senior health something, I think. It was they were here yesterday. In Lakeview.
They were?
The seniors.
At the senior center?
Yes, sir.
Do they come regularly or?
The first time I've seen them, I didn't
It's
know
been a
they
while.
even.
We get lots of
they're
questions
from-
about this exact
Yeah.
thing.
Yeah.
They're from Klamath Falls.
Do they?
Yeah, they come, I think, once a month. OHP definitely does. The SHEBA people have been the last 2 months. So that's the first I've paid attention to, because I
Yeah,
usually don't go to
me
the
too.
CDS, but yeah,
Yeah.
they do come here.
Yeah, they come and had a meeting
So
here
that-
yesterday.
Yeah.
Yeah, the acronym is the Senior Health Insurance Benefits Assistance.
Thank you.
First time I've ever heard of that.
It's a really important program.
So the other thing is, like that you were saying, that we have the Advantage Dental screenings coming up here at the end of the month on the 30th in Christmas Valley. And so they're working on trying to fill up that schedule as well, so that it's beneficial for them to come and travel all the way to Christmas Valley for that. The other thing is we're just wrapping up our North Lake School hygiene backpack grant program that we did this year. So we talked with the school and to find out what their hygiene needs were for their students. So they decided that they wanted K through 5th to get hygiene backpacks, since the older students had access to, showers and so forth in the schools. So what we did was we put together these backpacks with towel and washcloth, soap, laundry detergent, shampoo, manicure set, brush and combs, and then of course toothpaste, toothbrush, floss, and then deodorant as appropriate. The 4th and 5th graders got deodorant. But anyway, so Kathy went into the school, and we also had another outreach worker, and they kind of did a education piece for the little kids on good hygiene practices, and then they were given these backpacks to take home. And in them was kind of a letter to the parents, some little activities for the kids to do, and then also a survey for the parents to return to us. And then also surveys were given to the administration at the school and so forth, which was really beneficial to hear their feedback. And then we're also finishing refills. So part of it was kind of a couple of refills so that they had the necessary items throughout the whole school year. So our last refill is going to be here on June 4th before they head out on summer break. So the refills are a little smaller. It's the laundry detergent, toothpaste, bar soap, and shampoo. One of the things that we heard from the survey from the parents was for the girls, parents were kind of like, they don't know how to take care of their hair and how to brush their hair and tangles and all that stuff. So we're going to have a little hair clinic for the girls and so forth on June 11th at the conference room at the clinic there, and have kind of like a little kind of fun day and kind of teach them different hairstyles and how to comb and manage their hair. The other comment that we got a lot from parents that we relayed to Advantage Dental to help them when they go out to the school next year was parents wanting more kind of in-depth of how to brush your teeth and how to floss to the students. So we just relayed that to Advantage Dental so they had that information when they do their screening. So so we're just wrapping that up. And then, that's about it.
What kind of return rate were you getting on your surveys?
Let me see here.
I mean, you don't have to be specific, but I mean, in general, people send out surveys, and we don't generally have a very good return rate, but so if yours was really, good, that's cool. And we know that in Christmas Valley, you want to do better.
Shelley, are you finding?
Yeah, we did about,
Sorry.
oh, go ahead.
No, finish.
We did about 100 backpacks. And I want to say, we probably got maybe 30 or 40 surveys back.
That's good. Wow, for a survey, that's a very good return. Kudos.
And the kids we would give the kids little glow bracelets and stuff when they turn the back in.
Good job.
Yeah.
Shelley, is there a place where either at school or at the clinic where kids can shower or brush their teeth or wash their hair? For those kids that don't have running water?
Unfortunately, there's not, and it is an issue out there because a lot of students or a lot of families, they don't have running water and some don't have electricity, so that piece can be tricky. The school does work with students and so forth to try to help them. But as far as within the community, there really isn't kind of shower facilities available per se, unless you're like one of the kind of RV kind of campsite areas that they have.
Okay, great. Sounds like you're doing some great work. Thank you for that. Thank you to all of you for all the great work that you're doing on behalf of our community. It's really, it's amazing to hear all that is happening in Lake County. Some of it is sad to hear, but all of it is good. We're doing things to improve the health of our community. Are there, Arvinder, when are we scheduled for our next meeting?
June 14th.
June 14th. Excellent. Do we have any other issues that anyone would like to bring up? If not, thank you very much for your time and for all that you do. Really appreciate it.
What time?